Hi everybody, I'm Dr. Prem Anand here. Today I would like to have a small briefing on what is the dental implants. So everybody were aware of all the dental implants, what is there in the market, and it's been there for a very long time. So today's the newer advancements would be on the basal implants or the cortical implants, which are much more different from the regular dental implants what we've been using. So we have introduced this new method or the cortical basal implant in our practice, which enhances. There are a lot of differences when compared to the regular dental implants. So here I'm going to brief you on few of them. So what is the main difference between the regular implants and the basal implants? So these basal implants are taking the support of the cortical bone, unlike the alveolar bone. So what is this cortical and alveolar bone? So alveolar bone are the one where the tooth is supported, or the tooth bearing bone we call that. So we used to take these bone support and then give the dental implants in the conventional way. Now there are more cases like coming up with a lot of bone loss or medically compromised where they have diabetic and they have periodontal or the common disease called pyorrhea, which eats the tooth supporting bone. So that is when the tooth starts shaking, and we have to in a conventional way we have to graft the area. So we need to put a bone particles, cover it up, and then wait for 6 to 8 months, and then again do a recovery surgery, means open up the gums once again and then place the implants. Then again we give a 3 to 4 months or sometimes even 6 months. That is called osteointegration. That is one of the key feature for the regular implants. So after this we put an abutment. Then again there is a recovery surgery to open up the gums and put the abutment, which gives the support between the tooth structure, that is the crown and the implant. So this whole procedure is going to take a period of 1 year, like in the conventional way, like when there is no alveolar bone support, or when the client is having a medically compromised diabetics, or other associated hormonal issues where the bone is completely gone. So in this case the usual fixed replacement takes 1 year. So but now in this our basal implants or the cortical implants, we don't have to gauge the quality of the alveolar or the tooth supporting bone. We take the cortical bone, that is the basal bone. So this is very different from the alveolar bone, and this never resolves or this never changes with any quality of bone doesn't change due to the diabetics or any medical associated issues. It always remains the same, and this bone is a very good anchor for the implants. So we take this bone support and we give the implants on day one itself, and then even the restoration, that is a crown, is done on the similar day. So the whole process of fixed processes or the fixed tooth replacement is done within 2 to 3 hours. So this is, you can compare the difference between a 1 year period of time, 365 days, and how about getting everything done in 2 hours. And there are no stitches, there are no cut wounds, there are no surgical incisions, there are no closure of the wound, or there is a downtime, like you cannot do this, you cannot do that, there is nothing. So on the same day your tooth is replaced, you can go eat and be normal and do your regular activities as required without any hindrance. And there is no there is no pain at all, you can say, and there is minimal downtime, means there is nothing, you can go get recovered and do your regular activities on day one itself. And there will be some antibiotic coverage given for 2 to 3 days. Beyond that, there are no other restrictions, or there is no other downtime in this cortical implants. There are so many success stories, the clients who have done from us, especially the clients with the full mouth restoration. So it has been a very great help to them, and it's a miracle that they come get the whole implant done and the same day they get the teeth replaced in a fixed way. So especially for the full mouth cases, we strongly recommend the cortical implants than the regular implants. And it is a very no cumbersome procedure and very simple, and the maintenance or the hygiene of these implants in the long term is 100% better than the regular implants, where the clinical researchers or the evidence-based research has proven this in the multiple cases. So come try with us the new version of cortical implants and get your teeth fixed, or having your fixed teeth within just 2 hours of time.